So don't discourage them from using it. Support them. Tell them, I will come with you. I will come and visit you. I will be there when you speak to your psychiatrist. And don't see us as the enemy, because I can assure you, having worked in the NHS for several years, that the vast majority of them, and that's psychiatric nurses, psychologists, psychiatrists, we came into this job not for the money, because we would have become bankers and that was it. We came in because we have a genuine care and compassion for people suffering, and we are trying our best, and we are on your side. Yeah? Okay, so my overview of my presentation is, first of all, how do you know somebody is not just feeling blue, and when does a depression become an illness that requires help? Then we're going to look at why do some people get depressed, then what protects against suicide. 15% of those diagnosed with depression are likely to commit suicide. So it's a very serious and silent killer, as Lali puts it. And what treatments work. Okay, the good news is there are a lot of treatments out there. They don't have terrible side effects as you see in movies, or you may have seen if you watched the theatre play One Flew Over the Cuckoo's Nest.
Yeah.
How many of you seen it? Yes. Yeah. It's not as horrible, please. And there are treatments involved. I'll also look at certain religious groups. Okay, just moving on to my next slide. So when all of us, and this is just normal, go through feeling in a day or in a matter of minutes, or
no, this is Periscope, it's not picture. It's Periscope, it's not picture. It's video. You want to? Okay. Okay, so we have to do it.
We all go through a plethora of emotions, and that is just being human. So if you are emotional, hey, join the club, you're human. So when does us feeling blue become a depression? And I would also like to say that, okay, when does it become a depression? For us as psychiatrists, the rule of thumb is when somebody is feeling low, not just for minutes or for days, but it goes on for weeks, so it's prolonged. 2, it is beginning to impact significantly on what is their normal level of functioning. So let's say we have a mother of 3 children, she loves her kids, she tries her best, being a mother is very hard. She almost gets them to school most days on time, some days she's late, she picks them up, she spends time as much as she can, she does things that she enjoys with them, etc. But she begins to feel a bit low, okay, and she's still able to get up, do this. This continues a few more days, a few more weeks, and she's really struggling to get up in the mornings. And the reason is she's really struggling to switch off at night. For some reason, when she's at night, she's just preoccupied by all the terrible things that happen in her life. And she cannot sleep, she's struggling. It moves on to the point where one day she's not able to take her children to school anymore. She arrives 1 hour late with her children. And this is getting progressively worse, to the point where her children are up and she's still fast asleep. It is beginning to impact on an area where she was functioning normally, and which is very important for most women, the maternal instinct. She may have begun to develop a depression. So that's the rule of thumb, where it goes from just feeling blue every now and then, like all of us do, and that is human, to it is now affecting someone's normal functioning, and it is prolonged, and she can't get out of it. Okay? So these are broadly the diagnostic patterns. There's a list A and a list B. So if you have 2 of list A and 2 of list B, that is a total of 4, we say you have a mild depression. And if you go further to having about 7, that is 2 or 3 of list A and about 4 on the other side of the list, we say you have probably got severe depression. Now, what is the importance of classifying it in this way? Because it tells you what treatments to offer. Okay? are these features? One, a depressed mood. So a person begins to feel low and they're not able to shake that feeling as easily. They have lost interest in the things they did enjoy once. For some people, they loved cooking and now they just can't be bothered. For others, they loved watching football and now they can't be bothered anymore. They find that they don't feel as energetic as before. And that's the list A. The list B is reduced concentration. So they're making mistakes at work. They're suddenly absent-minded. This is especially important for elderly. So when an elderly person comes to a clinic and they say, they've left, it's very unusual for them, but they have left their front door open a few times. They are, while cooking, they left the burner on. Because of their age, you may begin to think this is dementia, but depression can also mimic this. They can lose, because it affects concentration. People begin to feel guilty. I'm the most horrible person. I'm the worst doctor that has ever been. They become very pessimistic. They say, this is never going to get better. The hardest thing for me as a doctor is when people, not only are they ill, they begin to think nothing's going to help, and we say, it's okay, try taking these medication, or can we do this? And they're so sure that it will never get better. It's a horrible vicious cycle. They begin to have thoughts of self-harm. And as I said earlier, their sleep is disturbed. They just can't switch off their thinking and go to sleep. And even if they do, they wake up very early and they're not eating as much. Okay, moving on to the next slide. As I said, if you have about four of these, it's mild. If you have about 7, it's severe. And symptoms should have lasted for at least 2 weeks. Can we move on to the next slide? The stats in depression, Ladi touched on this. 1 in 5 to 1 in 10 people that you know will suffer with depression sometime in their life. It is a very common condition. In fact, it's one of the commonest reasons why anyone sees their GP. So if you feel depressed, don't feel stigmatized. You're part of a very, very, very large group of people. Yes? And the average age is the 20s. Women are twice as likely to get depressed. It's also important to know that there are different cultural presentations. So Asian women are very unlikely to say they feel depressed. They're likely to say, it's hurting here, I've got a pain in my chest, I've got pains here. Because of the stigma associated, they're more likely to express their depression in the form of physical symptoms. Okay, moving on. There are special groups of people who are particularly vulnerable to getting depressed. That is women who've just given birth. Then elderly. When I was a junior doctor many years ago working in casualties, as a rule of thumb, if an elderly person came in and was depressed, we would very, very likely admit them because they're at high risk of depression, high risk of committing suicide through depression, and physical health problems. Now, I really want to touch on this. It's very important to know, as I said earlier on, depression is an illness. And just like all illnesses, it affects our body, okay? Which is why certain physical health problems like strokes, Parkinson's, etc. increase the risk of depression because depression is an illness. It's very important in such cases to get treatment for the depression. What am I talking about? You may think somebody who's healthy, who's a top executive, who's got a family, who's got it all going, and suddenly they have a stroke and is on a wheelchair, gets depressed, you think, okay, that's natural. Yes, it is natural, but it can become an illness in itself. It can still be treated, and if they receive treatment, it will improve their recovery of the strokes. Okay, recently I went to a large international conference on cancer, on terminal illnesses. Terminal illnesses are like terminal cancers, etc. I was asked to speak as a psychiatrist, but one of the interesting comments that was made, now listen very carefully, if somebody has a terminal illness, they got motor neuron disease, and they're wheelchair bound, multiple sclerosis, and things are getting worse, cancer, and they are thinking of killing themselves. And these are some of the top professionals. This is what they said. It's very likely because they're suffering with symptoms that medication can easily treat. Okay? So just because it is expected that a woman who's been married for 20 years finds out her husband is cheating and is going through a divorce, it's fully natural that she begins to feel depressed. That does not mean it is no longer an illness that can be helped enormously by the right professional help. Okay? So moving on to the next. So why do some people get depressed? There are biological reasons, ways of looking at it, psychological ways, social ways. Yes, genes may play a role. Okay? If 1 in 5 of relatives of those with depression may suffer with a depressive illness, if you have a grandmother, etc., there is an increased risk. And it's important to say, just because there's an increased risk, that doesn't mean everybody will get depressed. The minute I walk into an aeroplane, there's an increased risk of me dying by the plane crash. That does not mean I will necessarily die of this. So don't get worried just because you may have a relative who suffered with depression. There are certain personality types. There are childhood experiences. Moving on to the next slide. Very important. How does depression bring about its symptoms? It reduces the brain flow to certain areas of the brain which affect motivation, the way we feel, our energy levels. It is an illness. It can affect our immune system. Now, one of the most important causes of depression, I'll be very honest with you, we don't exactly know what is the exact cause of depression, but we think it is because of an imbalance of a chemical called serotonin in the body. Let me try and explain this. When I turn on the light, okay, if I go to a switch and I turn on the light, what's happening basically is electricity is moving from the switch that I turned on to the light which comes on. So if there is a flow of electricity, our body works as one big electrical system. We are one power, we are one power station. And this constant electricity, is being moved through our nerves. And this is how our body communicates to different parts. So if my mind thinks I want to walk there, immediately, a whole set of nerve impulses are moving through my nerve cells. And for the nerve cells to communicate one to another, there are messengers. And these messengers we call neurotransmitters. One very important one is serotonin. So one of the predominant theories for the cause of depression today is that there is an imbalance of serotonin. So what many of the antidepressants do is try and correct this chemical imbalance. Okay, moving on to the next slide. Now, what are the other theories? The psychological theory. Freud has an excellent way of looking at it. He looks at depression as a form of mourning, meaning a loss. So let me give you an example. A young boy at the age of 10, he loves his mother. His mother develops cancer, she dies. It's very, very tragic. But he works very hard, he does well at school, he gets a really good job, he's really doing well in his late 20s. He's married, he's got children, everything. His boss lets go of him, and suddenly he is depressed. Why? Because he has lost something very important to him, and suddenly without even consciously realizing it, the terrible pain he felt as a child when he lost someone very important comes rushing back, like a trigger that was waiting to go, like a time bomb. So Freud puts depression, sees it as a form of mourning, yes? It's very important to know that people who suffer depression, there may not be any trigger. So sometimes it looks like everything's going well, and you sometimes have a celebrity saying, everything was going well for me, and I became depressed. Okay, so it's very important to know there is not necessarily a trigger. Then there are, very importantly, distorted ways of thinking. So when you see, I still remember in my private practice seeing this young lady once, many years ago. She was very well dressed, she was very articulate, she had a really good job, she had a boyfriend, etc. She spoke to me for 1 hour about what an evil, wicked person she is. You know, she's the worst girlfriend anybody could hope to have. And I told her, you know, when you walked in, I saw an attractive woman, a successful woman, a woman with everything going. But for the last 1 hour, I've heard the story of the worst human being on the face of the world. Why? Because her thinking pattern was so negative. I am horrible, and I'm never going to change. Things will never get better. Okay, so move on to the next slide. Okay, there is a strong family history. We mentioned medical problems. And an important study in London many years ago found that a single mother having something like 3 children to look after, you know, not being able to work outside because she can't afford to do it because childcare is very expensive, is very prone to get depressed. So, social factors. Yes, moving on. Depression can be a part of other mental illnesses like schizophrenia, manic depression or bipolar illness, and schizoaffective disorder. Moving on. So what are the treatments? Have all of you heard of the NICE guidelines? The NICE guidelines are the National Institute of Clinical Excellence guidelines. So they sort of broadly, you know, decide on what treatments can be given in Britain. Yes, and this is what we refer to. The NICE guidelines differ, you know, separate depression into mild depression, low or low-grade depression, into mild but persistent resistant depression. And so on the basis of this, what they say is somebody's just got a low mood, etc., they're not quite sure. First of all, they just say watchful waiting, you know, they've just been depressed a few days, etc. Let's see how it goes. Things may get better, go to the gym, you may feel better. But if it is mild and persistent, they then suggest that, you know, maybe you get some talking therapy. And the talking therapy that is most prescribed in Britain, because it is the most research-based, is CBT. Dr. Ajay's here, that's right. CBT or cognitive. I'm going to show you a short video of a GP offering CBT. I wonder if you've got my video? Yeah. What I'd like to tell you about CBT is, first of all, it does not dwell on a person's background. So it doesn't look at all your problems, because some people don't like to see a therapist because they think their childhood is a can of worms and they don't want to talk about it. And one of the usefulness of CBT is it doesn't go into your background. It deals with what your patterns of thinking right now. Second, because it has been there for decades, there are different ways in which you can receive it. Now, there is an interactive computer program called Beating the Blues. So if you just Google Beating the Blues, it'll come up. And I think it's about 30 or 40 pounds. You can do this program over 8 sessions. And there is good evidence that it will help you overcome your symptoms. There are also good self-help books on Amazon. So if you Google in Amazon self-help CBT for depression, it will come up. These have been found to be effective. One of the best things for me, I remember as a junior doctor, this is not to do with depression, my consultant telling me that, giving me this book on eating disorders and saying, if somebody comes in with an eating disorder, initially, why don't you offer them this book? And I was thinking, this is a crazy idea, but let's give this a try. And I remember this lady turning up with who's clearly had an eating disorder. And I told her, why don't you try this book? And then I forgot about it. She came back in a few weeks, having read it and cured herself. So you can cure yourself of depression, especially if you've got mild depression, with a self-help book or a computer program. If this persists, this is a time when you should start seeing your GP. But the good news is we have lots of new antidepressants which are effective, which have very few side effects. And if it becomes very severe or recurrent, we say CBT plus depression. These CBTs as effective as depression, but you should realize when somebody is very, very depressed and not motivated, they may not even be motivated to go and see a therapist, or read a book, which is why it's important then to treat them with antidepressants, because that's literally popping a pill that can get them to a state, feel better enough, well enough to then take CBT. For severe depression, recurrent depression, in extreme cases, NICE guidelines does still offer ECT or electroconvulsive therapy. Should we move on to the next slide if we have a problem with the video? Should we show the video?
The following scenario looks at using a brief CBT approach for a depressed mother with a young child. Depression is characterized by negative thinking styles, low mood, fatigue, and a reduction in activity levels. Notice how the GP uses the structured 5 areas of the cognitive behavioural model to identify the individual patient's specific negative thoughts about herself as a mother, as well as her key unhelpful behavioural changes. Later, she offers an empowering explanation for the patient's tiredness symptoms, which she calls depression tiredness. This helps to provide a rationale for increasing her activity levels.
I know when we met a few weeks ago, you were quite keen to look at some ways to try and manage your depression maybe without medication. Is that what we're doing today?
Yeah, not that one.
Right, okay. I'd like to take some notes if that's okay, just to keep track of what we talk about. Would that be okay with you? You can have a copy to take away afterwards. What I find quite helpful is if we talk about a specific situation. I wonder if you could just think of a time, maybe a recent time, when you felt particularly depressed and it affected you.
Well, a few weeks ago I was due to meet up with some friends for antenatal classes. We used to meet up every week. But I felt so tired and low, I just couldn't go.
Right. What was going through your mind when you were feeling tired and low that stopped you wanting to go?
Well, I started thinking about the other mothers laughing and chatting, and I wouldn't have anything to say. Well, they won't be there if I was just going to make everyone else miserable.
They sound like really difficult thoughts to have. And how did it make you feel when you were thinking that?
Really low.
Right, okay. It's really understandable, I think, that you feel low if you're having quite self-critical, very negative thoughts, and that's quite common in depression to have those type of thoughts. Did it make you think anything about how they might see you, for example?
Well, the other children always seem so happy. I started thinking maybe the other mothers doing a better job than me.
Right.
I worry about that mommy wonders if she could go on to my other mum.
Right, okay. That must be really painful. How does it make you feel to think that Molly might be better off because of the other mum?
I feel really sad.
What tells you that Molly might be better off because of the other mum?
Well, I always seem so in control with my depression. I feel guilty that I'm not a very good mother.
You mentioned a number of emotional feelings. You said you feel fed up, low, sad, and sometimes guilty. Do you have any physical symptoms or body reactions?
I get quite tearful, although it's mainly when I'm on my own. I'm so tired, just don't have the energy.
Right. Are you getting good sleep at the moment?
Well, Mommy keeps me out sometimes at night, that makes me tired. But even after a good night's sleep, I'm still exhausted.
Right.
I thought that's a very good video because surgeries are now offering CBT. It can be done in just, sometimes even in just 3 or 4 sessions. So just have to see your GP maybe for, once a week, for 4 weeks. A session doesn't last very long. In fact, that is a 20-minute CBT session. So what they train you to do is, when somebody is depressed, they have certain automatic ways of thinking. So, they begin to think as this mother does, I won't know what to talk about, maybe I'm not such a good mother. So these negative thoughts, etc. And if I stood around you and I was negative towards you, saying, you look ugly, gosh, you look like a clown, you would begin to feel terrible. But the reality is, your mind is now doing this constantly. So what CBT helps you do is identify these thoughts and teaches you to challenge it yourself. Okay, so when these thoughts come, you say no, you know how to challenge it. Okay, I just thought this was a good time to just ask you, I've been talking at you for a while. Why do you think people don't necessarily get professional help when they are depressed? Please.
Second microphone.
Sometimes they can be in denial because there's still a lot of stigma associated with mental health issues.
Now, thank you, that's very correct. And the very important reason people will see their GP if they see a lump in their breast, but won't see their GP if they're depressed is because of stigma. There are a lot of irrational fears. First of all, can I just say, it is very, very unlikely if you're depressed that you will wind up in psychiatric hospitals. Because most people with depression, I think my psychiatric colleagues will agree, are treated as outpatients. Okay? So you're very, very unlikely. And secondly, I think I have to talk about the elephant in the room, isn't it? I think we psychiatrists, as a unique group of doctors, we do sometimes treat people against their will and are allowed by law, what we call sectioning. So can I just say that it is very unlikely that if you have depression, you will be asked to come into hospital, first of all. Second, if you receive treatment early on, it is very, very unlikely that you will progress to the stage when you are frankly suicidal and you're refusing treatment and people want to section you. I think it's fair to say I hate sectioning people, and I think that's true of most of my colleagues who have to do it. We hate it. It's not something we want to do, and we look at all the other options. It's only when we think that there is just no other way, that we have to do this. So if you have been through this, or if you have known a family member who's been through this, you know how painful it is, but it is in order to prevent someone from taking their life. Yes?
Many people think it would be a lot better to pray off, reject it by fire.
Sorry?
Okay. Many people that they believe in, particularly in Christian circles, I'm a pastor, is that it's best to pray things like that off, reject it by fire, and say it's not your portion, and then they think it will go somehow. Fortunately, if it's an illness, it's got to be dealt with.
Yes, I think that you've done really well, Pastor, by saying that. Interesting, one of my slides later on is going to look at some evidence that, in fact, prayer does help with depression. It improves the brain flow to the areas that are affected. So, having said that, my husband and I, my husband's Jewish, and I'm a Christian, we wrote a paper which we never finished, where we looked at depression in the Bible. And our interesting finding was, we searched for the term depression throughout the Bible, it doesn't exist. But it refers to other areas like sadness, feeling low. And what we realized is that, number one, as I mentioned earlier, the Bible is one of the oldest books to acknowledge illness. Second is that there are a lot of Christian books written which refer to depression and demonic possession, but in fact the Bible almost never says that. It normalizes depression, so Hannah, a woman without a baby who's desperate for a baby, gets depressed, and the priest says, "You're depressed," and he offers us what is the first record probably of talking therapy. He talks to her and she feels better. Okay? Second, it is normalized, but it's not demonized. In fact, I think there's only one reference, a garment of praise for a spirit of heaviness, which is vaguely demonic. Importantly, the Bible talks of Jesus being sad. We don't know if it was clinical depression because we can't diagnose something that happened 2,000 years ago because we need to follow our criteria as psychiatrists. But he says he was depressed, and the Bible talks about not being depressed. So it's very important to know, I'm pleased as a pastor you spoke up, that it is an illness, it is normal, a lot of people go through it, there are treatments out there. Okay, I'm just going to round up my...
ask one question.
Sure.
I think normally most of this problem comes out of definition. Just like what you said, the Bible talks about depression but does not call it depression. It calls it sadness and things like that. I believe most people will run away from seeing a psychiatrist because they believe they compound their problems by giving them this long text of, that you need an encyclopedia to go through. And that generally is another area that would take people away from dealing with the experts, I would say.
I think that's a very good point. But just to say, if you come and see me in the clinic, I'm not going to tell you all the causes of depression. It's such an extreme. I'm giving a talk here, which is why we're going through the details. I think you raise a very good point. I remember giving a talk about depression in my local coffee shop, and so many people turned up. And I just thought, you won't go to a community mental health center, really, but you will come to a coffee shop, because the minute you move out of the clinic to a place like this, you suddenly destigmatize it, which is why it is important that we take it to where people are, into coffee shops, into places like this. There are churches running dealing with depression courses. There are Jewish communities that run things in their community. It's important to take it out of there, not so people don't get professional help, but people are steered in the right direction. You do need professional help in many cases. Yeah? Okay, I'm just going to finish up quickly.
Sorry, can I?
Sorry, I just need to
You
finish.
said something about...
We have an open mic session later where we can ask questions. I'm just quite conscious of the time.
Oh, okay.
I'd like us to take a break so that we can have tea.
So I've just got 1 minute more faster. So do you want to just move on to the next slide? Yes, we talked about medication. I believe one of my colleagues is going to talk about medication, but there are lots of good antidepressants, very few side effects. Can we move on? There are therapy. There are different kinds of therapy. There's just counseling. There's CBT. There's CBT which can be given in groups. There's couple therapy. And there is also the old-fashioned Freudian therapy, which has now been found to be effective once again. If somebody's depressed and wants to talk about their past, the old kind of therapy also works. Okay, moving on. What about ECT? It is a very effective form of treatment. It is deeply stigmatized. It is still the gold standard of treatment for depression. We very, very, very rarely use it, but it is effective. Moving on. St. John's wort is a herb. The NICE guide, there is some evidence it is effective, as effective as an antidepressant, but the NICE guidelines suggest that we doctors don't suggest that you take it, simply because we don't know how much you've got to take, for how long before it's effective, and it can affect, although it's a herbal treatment, it can meddle with your other medication. Okay, moving on to the next. Suicides, this is an old statistic. In 2013, over 6,000 people committed suicide. 4 out of 5 were men. In the UK. 4 out of 5 are men. It is a bigger killer than traffic accidents. And in the age group of 20 to 40, as I said, this is slightly old, 25 to 50 years, the commonest cause of death in men is suicide. Not all of them are necessarily depressed, but a significant number are. Okay, moving on. Does Siroxat or paroxetine, which is all over the press a few years ago, increase the risk of suicide? To be fair, there isn't a great deal of evidence it does, but we don't prescribe it as much because of other reasons. It causes withdrawal effects when you stop it. Moving on, what about religious groups? There is something called Christian CBT, which is Bible-based, and it has been found to be more helpful for Christians than normal CBT. There is mindfulness CBT, which has been found to be especially helpful for Buddhists. My husband, as I said, is Jewish, but he does offer Christian CBT therapy, so you don't have to be a Christian to offer it, or for it to be effective. Okay? What protects against suicide? You know, a talk like this, like Ladi's, this thing has been found to be effective nationally to reduce suicide. The good news is the rates of suicide are going down in Britain. Hurrah, well done to all of you, psychiatric nurses, health commissioners, all of you, we are getting there. Is there any scientific evidence? Pastor, you talked about prayer. There's some evidence that reading Psalm 23 increases the blood flow to parts of the brain which are affected by depression. And then, repeated studies have shown that prayer, attending church, etc., improves the prognosis of depression. Religiosity improves outcome of depression, especially in the elderly. Going on. This is a new treatment. I wanted to show you a video, but we don't have time. Transcranial magnetic stimulation is a new treatment. I really don't know any NHS centre that offers it. You can get it in Harley Street. NICE guidelines does mention it. It is again effective for severe depression. So what they do is they stick a few electrodes. It isn't like ECT. It stimulates certain parts of the brain. It has been found to be effective. It has none of the side effects that ECT may have. But number one, it's not available in the NHS. Number two, it's really expensive if you go to Harley Street. But if somebody's suffering from severe depression, I would suggest they try it. NICE guidelines only recommends it for research purposes, but it acknowledges there are no side effects that are significant side effects that are known as a result of it. Okay, thank you so much.
Thank you very much, Dr. Dane. Very, very, very informative. Has anybody learned anything new today? I have. I'm very much interested in knowing the effects. Although I know psychiatrists will say that there are no side effects to some of these medications. We're going to put them on the stand later and we can ask them the questions. Because I know some people who have said that there are side effects to the medication. So we'll talk from the service user point of view, and then they will talk to us from the clinician point of view. We were supposed to have tea and coffee earlier. Is it okay for us to take a quick 10 minutes break? For anyone who wants tea, coffee, croissants, biscuits outside, just 10 minutes, and we'll come back in 10 minutes. Is that okay? Yeah? Or should we go on? We can go on. I'm up for it. But we'll just take a quick 10 minutes break and we'll come back. Thank you.
Your phone was ringing.
It's okay for us to go because they stopped.
Your phone was ringing and messages were coming.